you will as well.
We'll both take questions, but go ahead, Nancy.
Thank you so much, Dr. Jah. Has the president been tested to determine which variant he has? Is it BA.5? And if so, what does that say about his prognosis?
It's a great question. The virus has been sent off for sequencing. It takes usually about a week for that sequencing to come back. That's under normal circumstances. He's the president. The sequencing will get prioritized. So we should have an answer sooner than that. But you can't just tell from a regular test what kind of variant. So the sequencing results will be back at some point less than a week from now.
And has the president had to halt any of his regular medications now that he's taking Paxlovid? And what are you doing to mitigate the risk from halting those medications?
Yeah, so I had a conversation about this with Dr. O'Connor. There are two medicines he's on, Eliquis and Crestor, cholesterol-lowering medicine, and a blood thinner for his atrial fibrillation, both of which need to be stopped when you take Paxlovid. It's a very standard, common thing that we do when we give people Paxlovid. And you don't need to do anything in those circumstances. They both get stopped for the 5 days that he's on Paxlovid, and then they get restarted, and it's totally fine and pretty normal practice.
Go ahead.
Where exactly was the president infected?
Where was he infected? I don't think we know. I certainly don't know if you have any thoughts on it.
Look, I don't think that matters, right? I think what matters is we prepared for this moment. I think what matters is what Dr. Jah just laid out. If we look at where we were a year and a half ago, this is a president, when he walked in, one of his first priorities was to make sure we had a comprehensive plan to get people vaccinated. And so now today, look to today, more and more people are getting closer to having a more normal life. Vaccines are available, and as Dr. Jah said, if you have not gotten vaccinated, please do. If you have not, if you have not gotten boosted, please do. These are treatments that are going to keep you safe, and I think that's what matters here, is making sure that we continue to do the work. And the good thing is that the president again has been vaccinated and double boosted. Go ahead.
We know that rebound COVID cases have been a concern in some individuals who take Paxlovid. Are there any precautions you can take to try and prevent that, and how concerned are you that could potentially hinder his return to the office?
It's a great question. So let me tell you what we know about rebound. So we've looked at the clinical data on this, because if you look at Twitter, it feels like everybody has rebound. But it turns out there's actually clinical data. If you look at major health systems that have given out Paxlovid to tens of thousands of people, rebound rates are around 5%. There are some studies that says maybe 7, 8%, some that say it's 2%, but it's in the single digits. So it happens, it's not that frequent. But here's the key point about rebound, which is when people have rebound, they don't end up in the hospital, they don't end up particularly sick. And the goal of Paxlovid is to keep people from getting seriously ill. And so it continues to work. His physician is in charge of taking care of him. Obviously, the president will continue to be monitored, as he is, but the Paxlovid is working really well at preventing serious illness, rebound or no rebound, and that's why he was offered it, and that's why the president took it.